Hi, I'm Dr. Nichelle Haynes,
I'm Dr. Kristen Lassiter,
and we're medical mamas. This is your place for evidence-based information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
And breastfeeding. So today we're going to be talking about bupropion. It's just so hard. Today,
Bupropion.
bupropion.
Not to be confused with buspirone.
No.
Which I feel like patients get.
Oh yes, and they even have it in the thing where they like highlight the name like very. Anyway, this is going off topic really quickly. So, we're going to be talking about bupropion during breastfeeding and whether we generally consider it to be compatible or not. Here we go.
First, there is not a lot of research.
As always.
As always.
We should make a list of all the we should make a list of all the things we say in like pretty much every. There's not a lot of research. Do what's right for you.
Talk to your doctor.
Illness is not risk-free, right? Like there are things we can say all the time. Okay. Anyway, so with bupropion, it's a medication that we use for depression, for stopping smoking, for ADHD, sometimes for anxiety.
And the brand name is called Wellbutrin, or Fortivo,
For FeVO.
or Fivo.
And then it's also part of a combined medication called Contrave, which it's one of the components of. Anyway, so can we utilize this medication during breastfeeding? Basically, for context, when we talk about medications during breastfeeding, we talk about the relative infant dose. So unless there's something else that's like glaringly wrong, if a baby is exposed to minor amounts of the medication, we consider a medication to be safe if
Compatible.
compatible with breastfeeding, if the dose the child gets is 10% or less of the maternal dose.
And we don't consider it to be safe necessarily, but we consider it to be compatible.
Or like an option.
Yes.
Right. Like if a medication comes out in the same amount, and maybe it's the same amount, like we're going to be like,
Yeah. And the reason is because like breastfeeding in itself can have so many benefits.
Mm-hmm.
So we don't want to tell a mom, hey, you're using this medication, you cannot breastfeed.
Mm-hmm.
If it's under this relative infant dose of 10% and doesn't seem to, like you say, cause any blatantly obvious issues, then we consider it compatible with breastfeeding.
So this medication comes in a couple of different formulations, and the formulations somehow have been studied individually, which is nice. So the XL version of the medication is the longest acting version of the medication. Also, the medication, when it is metabolized or broken down in the body, there's the original medication and then like kind of the parts or the pieces. So the original medication is called a prodrug, and the prodrug is found in babies at about 0.2% of the maternal dose, which is great and wonderful. And then the metabolites of the broken down pieces are found in about 2% of the maternal dose, which is also good.
And to give you kind of some context for this, so sertraline or Zoloft, which is kind of considered to be, one of the best antidepressants to use in breastfeeding because it's secreted so little in the breast milk, that has a relative infant dose of 1 to 2%. So this is comparable to that.
Mm-hmm. Mm-hmm. And I guess the reason that they study the metabolites or the pieces, the broken down parts, is because they are also active. They're also active in the brain. So they want to know about that as well, which is good that we have that information. So the next longest acting form of the medication is called the SR, or the sustained release version of the medication. It's usually dosed twice a day, but I've had some people who just don't metabolize very quickly, and I'll just use it once a day. So for that one, they found that about 5% of the maternal dose was found from the relative infant dose. But there have been studies that range, or the times they took the samples, that it can range from about 1% to about 10%. So we would also consider that still to be compatible with breastfeeding. So for the vast majority of infants, this seems to be a reasonable option. But there are some case reports related to infants having seizure activity while their mom is on this medication they're breastfeeding. And that's probably related to this medication's ability to make it a little bit easier for your brain to get to a point where you can have a seizure. And I would say that, like, for the vast majority of people, that's not an issue. And for the majority of babies, I would say that's probably also not an issue. But there are a few case reports for that.
Yeah,
Is a thing.
the same thing can happen in people and adults when they're taking this medication. A very, rare side effect is that they can have a seizure with this medication. Same thing can happen with infants.
Yeah, I would think also for some context is that we found that association between this medication and seizure risk at doses that we don't currently use anymore. That's what's for doses like 600 or I think even 750 maybe. But now the maximum we usually use is 450 milligrams. So that's reassuring, right? We don't use those doses anymore. So I think it's important to talk to your pediatrician about your baby's individual risk, because I imagine there are some babies that their risk of seizure is already higher, or they have brain injury, or there's some reason why this may not be compatible for you specifically to be utilizing, or there may be other ways to reduce risk, like either we could use donor breast milk, or we can supplement with formula, or either there's other things that we could do that it's not necessarily probably a hard no. It's just like, let's have the discussion. So overall, we would say this medication is compatible with breastfeeding for the majority of people, but always talk to your doctor about your risks and your baby's risks as well. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.